और सभी को मैं वेलकम करना चाहता हूं सर को, डॉक्टर विजय सर का बहुत बिजी स्केड्यूल रहा। जो टाइम उन्होंने आज दिया, और ये जो पूरे जो रिसर्च जो नेचुरल हेल्थ मैटर्स का किड्स न्यूट्री इम्यूनो के ऊपर आज हुआ है, सर आज आप लोगों के सामने एक्सप्लेन करेंगे। और जो एक गेम चेंजिंग हो सकता है चाइल्ड न्यूट्रिशन के मैटर में। सो आई वुड लाइक टू वेलकम टू डॉक्टर विजय देव सर। सो चैट बॉक्स में सभी ने वेलकम कीजिए सर को, जल्दी जल्दी वेलकम कीजिए सभी ने। वी हैव ऑलरेडी 73, और मुझे पता है आज 100 का कोटा कंप्लीट हो जाएगा, और ये लाइव भी इसको करवा दे रहा है। सो सभी ने प्लीज वेलकम, वेलकम टू डॉक्टर विजय देव सर। सर आपको मैंने ऑलरेडी स्पॉटलाइट कर दिया, और को होस्ट में आप है। प्लीज सर कंटिन्यू।
Thank you very much. Today we'll discuss, the clinical trial. पहले मैं एक चीज बोलना चाहता हूँ. If you ask me, in case of fixed dose combinations clinical trial, nobody, even in the multi-level marketing, even also in pharmaceutical industry, everybody, when they substantiate the efficacy of the product, we have also done the same thing, that individual ingredient, what is their function, that we have explained, and accordingly we have promoted the products. ये सारे कंपनी ऐसे ही प्रोडक्ट प्रमोट करते हैं, जो जो इंग्रेडिएंट्स उन्होंने एक फिक्स्ड डोज कॉम्बिनेशंस में डाले हैं उसका फंक्शंस बताएंगे एंड उसका एफिकेसी बताएंगे। बट आप लोगों ने कहीं सोचा जी इतना सारे इंग्रेडिएंट एक फॉर्मुलेशंस में है, जब एक फॉर्मुलेशन इन इंग्रेडिएंट्स है, वो जब हम किसी को दे रहा है उसका क्यूमुलेटिव इफेक्ट क्या होगा, हम लोगों का पास कोई डेटा नहीं होता है। उसका क्या साइड इफेक्ट्स होगा उसका भी कोई डेटा हम लोगों का पास नहीं है। जितना सारे एमएलएम कंपनी है उस कॉम्बिनेशंस का क्लिनिकल डेटा नहीं है। इवन हर्बलाइफ, it is a very eminent multi-level marketing company, but they do not have any clinical data for the fixed dose combinations. Now, here when we have launched this product, Kid Nutri-Immuno, you understand one clinical trial, if you'd like to do such clinical trials, you have to spend a lot of money. One clinical trial, you have to spend not less than 50 lakhs. If you'd like to do even the pilot study, that is a small number of participant or patients, if you take into consideration, it is 24 to 25, that your 50 to 60 lakhs rupees you have to spend for the same. At this juncture, I would like to thank all directors of Natural Healthy Mill Matters, Natural Health Matters, that they have thought about that there is a necessity of do the clinical trial, particularly for fixed dose combinations, where we can bring the actual fact in front of people that yes, when this product will be given to our kids, then what will be the total outcome of this product, and इसका कोई साइड इफेक्ट्स है कि नहीं, इसका एफिकेसी क्या होगा। हम लोग बोल रहे हैं कॉग्निटिव फंक्शन बहुत अच्छा होगा, ग्रोथ अच्छा होगा। सो ये सब इंडिविजुअल जो इंग्रेडिएंट्स है उसका हिसाब से हम लोग बता रहा है, लेकिन हम लोगों का कोई अता पता नहीं है कि जब हम ये सारे इंग्रेडिएंट्स एक फॉर्मुलेशंस में डाल के एक चिल्ड्रन को दे रहा है, एक किड को दे रहा है, व्हाट विल बी द टोटल आउटकम। दैट इज पॉसिबल ओनली थ्रू क्लिनिकल ट्रायल। और ये जो क्लिनिकल ट्रायल भी है वो उतना आसान नहीं है। आपको ये क्लिनिकल ट्रायल हॉस्पिटल में करना पड़ेगा। हॉस्पिटल में जब आप क्लिनिकल ट्रायल करेंगे तो आपको थ्रू सीआरओ जाना पड़ेगा। सीआरओ मीन्स क्लिनिकल रिसर्च ऑर्गेनाइजेशन। We have gone through the CRO, Clinical Research Organization of Chennai. And when you go through this CRO, Clinical Research Organization, then what you have to do, you have to first get the ethics committee approval, EC committee approval. इसका मतलब क्या है, आपका जो क्लिनिकल ट्रायल है उसका प्रोटोकॉल आपको सबमिट करना पड़ेगा। प्रोटोकॉल क्या है, मीन्स कितना नंबर ऑफ पेशेंट्स का ऊपर आप ये क्लिनिकल ट्रायल करेंगे, क्या आपका इंक्लूशन क्राइटेरिया होगा, क्या आपका एक्सक्लूशन क्राइटेरिया होगा। हाँ, सो एथिक्स कमिटी जो अप्रूवल वो आपको लेने के लिए ये आप प्रोटोकॉल सबमिट करना पड़ेगा। जब आप ये प्रोटोकॉल सबमिट करेंगे एथिक्स कमिटी को, आपको लॉट ऑफ क्वेश्चंस यू हैव टू फेस। व्हेन वी हैव सबमिटेड द प्रोटोकॉल ऑफ किड न्यूट्री इम्यूनो, we received multiple questions from the ethics committee, and we have given the answer from the CRO, clinical research organization. When they have satisfied, then they have given the approval that yes, you can go ahead with the clinical trial. Now ye to approval EC committee se mila, then we have to register it in government portal, that is called CTRI registration. It takes 7 to 10 days to register in CTRI, and we get the number from the government portal, government. That CTRI registration number, it will help when we'll complete the clinical trial, then we'll be able to publish this clinical trial in the index journal. Then next question comes, though it is a Nutra product, but we do not have to take the approval from DCGI, Drug Controller General of India. But क्या करना पड़ेगा, हमको नोटिफाई करना पड़ेगा जो किड न्यूट्रो इम्यूनो का ऊपर क्लिनिकल ट्रायल हो रहा है। ये क्लिनिकल ट्रायल बेसिकली ये जो फिक्स डोज कॉम्बिनेशंस है उसका क्या एफिकेसी है एंड कोई साइड इफेक्ट्स है कि नहीं, ये जांच करने के लिए ये क्लिनिकल ट्रायल हम लोग कर रहे हैं। सो ये जब हम नोटिफाई किया DCGI को, DCGI से सारे क्वेश्चंस आया, multiple questions they have asked, and we have given the answer, and then they have given the approval. Now I'm straightway going to the clinical trial. We have done the clinical trial. All of you are very much anxious about this clinical trial. What was the outcome of this clinical trial? Is good, it is bad, or this clinical trial, whatever results we have obtained, that it will help to promotion by product, and we'll be able to see that yes, this fixed dose combinations is really good enough and it is better than any other kid Nutri-Immuno. Let's see, we'll go to straightway to our presentations. Now I will share my presentations. All of you can see the presentations. I think that it is visible.
Yes, feasible.
I think that presentation you can see. This is a
Yes.
kids Nutri-Immuno supplement result presentations. Now, the title of this study, if you see, ये जो study था, ये study open level clinical study. Now, open level clinical study का मतलब क्या है? That means the participant or the children whom you are giving this particular supplement, they know that what they are taking. So that is open level. And if it is a if it is a blind level, that means you are not disclosing that which particular supplements you are giving to the kids. Now, in our case, it is open level. This open level clinical study, हम लोगों का क्या मकसद था? We have two intentions. Number one is हम लोग क्या देखना चाहते थे कि मेरा जो फिक्स डोज कॉम्बिनेशन है ये किड न्यूट्री इम्यूनो, इसका एफिकेसी क्या है? इतना सारे इंग्रेडिएंट्स ये किड न्यूट्री इम्यूनो में है, हम लोग इंडिविजुअल इंग्रेडिएंट का बारे में बता रहा है कि इसका कॉग्निटिव फंक्शंस बेटर होगा, ग्रोथ होगा चिल्ड्रन का, इम्यूनिटी अच्छा होगा, इवन कोई इन्फेक्शंस नहीं होगा, then they can prevent the infections, upper respiratory tract infection, gastrointestinal tract infection. ये हम लोग जांच करना चाहते थे जो मेरा किड न्यूट्री इम्यूनो है. So it is a open level clinical study. सबको समझ में आ गया? Open level clinical study का मतलब है हम जब ये supplement किसको दे रहे हैं, they know that what they are taking. They know that they are taking kid Nutri-Immuno. It is not blind study. Now, इसका sponsors है Naturo Health Matters. The entire cost has been borne by Naturo Health Matters. And CRO Clinical Research Organization, that is KI3 of Chennai, they have conducted this clinical trial. Different sites I will talk about that where this clinical trial has been conducted. and who are the principal investigator, who is the coordinator, everything I will disclose you. ये स्टडी साइट है जहां पर ये क्लिनिकल ट्रायल हम लोगों ने किया, वो है श्री लक्ष्मी हॉस्पिटल्स, दैट इज इन चेन्नई, एंड सेकंड वन इज ग्रेस इन ट्रिनिटी हॉस्पिटल्स, दैट इज इन चेन्नई. Now, who were the principal investigator and co-investigator for this clinical trial? Dr. Ananda Babu, he is a MBBS MS. He was the principal investigator. It is from Sri Lakshmi Hospitals. Second investigator, they are the principal investigator. We have taken two principal investigator, one co-investigator. Another principal investigator is Dr. Ramesh Kannan, MBBS MD, and your Dr. Denison Prince. He is a MBBS DCH pediatrician. He is a co-investigator. He is from Grace in Trinity Hospital. That is Chennai. Chetpet is in Chennai. And Dr. Bijoydev, myself, MD, CFN, and DPN, that is project coordinator from KI3. Because the entire project, it has been coordinated by me with this principal investigator and the co-investigator. Now, objective मैंने आपको बता दिया जी, हम लोग देखना चाहते थे जी इसका एफिकेसी क्या है और कोई साइड इफेक्ट्स है कि नहीं. नाउ हम लोगों को एज ग्रुप चूज करना था. कौन सी एज ग्रुप में ये किड न्यूट्री इम्यूनो हम लोग देंगे, एंड वी वुड लाइक टू जज द परफॉर्मेंस ऑफ दिस पर्टिकुलर प्रोडक्ट. ये था चिल्ड्रन एज ग्रुप 4 to 12 years, and we also would like to check the safety of kid Nutri-Immuno supplement. Now, I have told you that इसी कमिटी अप्रूवल मिलने का बाद हम लोगों को क्या करना पड़ेगा, हम लोगों को CTRA रजिस्ट्रेशन करना पड़ेगा. आप देखिए that 17/12/2024 हम लोग ये क्लिनिकल ट्रायल को रजिस्टर्ड किया. आप लोग इंटरनेट में जाके ये आप टाइप करेंगे, ये रजिस्ट्रेशन नंबर, आपको ये पूरा क्लिनिकल ट्रायल आपको मिल जाएगा. इसका जो प्रोटोकॉल है, you will be able to see that because it has been already uploaded. Now, ये CTRI registration मिलने के बाद हम लोग DCGI को notify किया that we are doing a pilot study. Now, pilot study का मतलब क्या है? When आप कोई clinical trial 24 to 25 patients का ऊपर कर रहे हो, इसको पायलट स्टडी बोलते हैं. और जो फुल फ्लेजेड क्लिनिकल ट्रायल बोलते हैं वो 200 to 250 पेशेंट्स का ऊपर. सो ये पायलट स्टडी था किड न्यूट्री इम्यूनो सप्लीमेंट का. कितना किड वी हैव टेकन इनटू कंसिडरेशन फॉर दिस क्लिनिकल ट्रायल? 24 पार्टिसिपेंट्स वी हैव टेकन इनटू कंसिडरेशन. साइट ऑलरेडी आपको मैंने बताया, ये साइट का ही एथिक्स कमिटी था. एक तो आपका ऑक्सीमेट एथिक्स कमिटी जो श्री लक्ष्मी हॉस्पिटल में है, एंड PM एथिक्स कमिटी जो ग्रेस इन ट्रिनिटी हॉस्पिटल में है. नाउ आपका ये जो 24 पार्टिसिपेंट है, सब लोगों को मालूम है जो क्या इंग्रेडिएंट्स है किड न्यूट्री इम्यूनो. बिकॉज मैं तो बहुत बार इसका बारे में आपको बताया जी. वी हैव अ ब्लेंड ऑफ सोया and concentrated whey protein. Then we have a DHA, L-methionine, choline, vitamins, lysine. Even also we have given the probiotic. So these are the things you know. And here, high quality protein, we have given the blend of soya and whey protein concentrated. Probiotics है, particularly for gut health के लिए. DHA आपको मालूम है कि cognitive functions के लिए it is very effective. Colostrum जो very few फॉर्मुलेशंस पे आपको मिलेगा, बट थेराप्यूटिक कॉन्सेंट्रेशंस में कोई नहीं देते हैं. इवन ये जो कोलोस्ट्रम का आपका ग्रेड है, वो भी आप देखेंगे जे grade 3 और grade 2 का colostrum they have used, but we have used grade 1 colostrum. That बहुत बार मैंने आपको इसका बारे में बताया. And even also give the blend of vitamins and minerals. And our product, as because it is meant for our children, it is absolutely fat free. So ये जो clinical trial था, ये 8 weeks का था. 8 weeks means your 2 months. and standard of care treatment, because किसी का respiratory tract infections है, किसी का GI infections है, उसमें जो therapy देना चाहिए था वो children को it has been given, that has not been stopped. That's why it has mentioned standard of care treatment, it has been given. Second one is that major thing is that all children, they were malnutritions. Now, हम जो malnutritions बताएंगे, उसका मतलब क्या है? Malnutritions, if you take into consideration, this malnutrition generally occurs because of two reasons. One is that you are not getting the adequate nutrients. That's why you have a malnutrition. You have a deficiency of nutrients. आपका growth नहीं हो रहा है, आपका cognitive functions ठीक नहीं है, आपका activity performance, आपका fatigueness, tiredness, ये सारे है. Another one is that you are getting nutrients, but these nutrients are not being absorbed from the gastrointestinal tract, malabsorption. So one is that in deficiency of your nutrients, that's why there is a malnutrition. Another one is that proper absorption नहीं हो रहा है body में nutrients, malnutrition इसीलिए हो रहा है. Here जो participant we have chosen, they were all suffering from malnutrition. They are not a normal child. They are suffering from malnutrition. Why I'm telling again and again this particular point? Because clinical trial we are doing on a diseased children. Those who have the malnutrition, we have considered those children. Normal a child, those who have a good growth, cognitive function, if you give this particular formulation, you will not be able to judge that kid Nutri-Immuno efficacy is how much. Because already that child is normal, uska growth भी normal है, uska cognitive functions भी normal है, usko किड न्यूट्रो इम्यूनो हम देंगे, एक क्वेश्चन आपका दिमाग में आएगा, अरे ये तो नॉर्मल चाइल्ड है, इसका तो इफ यू गिव किड न्यूट्री इम्यूनो और इफ यू डोंट गिव किड न्यूट्री इम्यूनो, इसका ग्रोथ होगा, इसका कॉग्निटिव फंक्शंस बेटर होगा, इसका इम्यूनिटी भी बेटर होगा. ये क्वेश्चन आपका दिमाग में आएगा, ये सवाल आपका दिमाग में आएगा. लेकिन ये क्लैरिफाई करने के लिए बार बार एक चीज मैं बता रहा हूं, जिसको ये किड न्यूट्री इम्यूनो वी हैव गिवन, दे आर ऑल malnutrition child. Now here we have taken the age group already. I have told that 4 to 12 performing nutritional assessment जो हम लोगों ने लिया, वो है height for age, what should be the height based on the age, and weight for height, and based on weight what should be the height. And that we have taken into consideration mid upper arm circumference we have checked. MUEC, it is known, and this is as per the guideline of WHO. And we have checked these things. And we have taken those of participant, the children, parents, and legal guardians, they should be in a position to understand the informed communications or consent. Even they should be voluntary. They come and they participate in this particular clinical trial. Now, I have told, कभी भी आप कोई clinical trial करेंगे, उसमें some inclusion and exclusion criteria रहेंगे. ये inclusion and exclusion criteria का मतलब क्या है? किसको हम ये clinical trial में लेंगे, वो है inclusion. किसको हम ये clinical trial में दाखिल नहीं करेंगे, वो है exclusion criteria. So there are certain parameters are there. Children with known allergic manifestation has not been taken into consideration in certain cases. The children with current illness requiring hospitalization, children with GI infection, and also sufferings from diarrhea, those children, it has not been taken into consideration. That is in exclusions. Children on medications could affect absorption and metabolism of study product that I am giving kid Nutri-Immuno. Like the children is taking certain medications for certain disease. It can impair the absorption of these nutrients. those children we have not taken into consideration in this clinical trial. If the children has tuberculosis or hepatitis B or HIV, that sort of children we have not included in this clinical trial. Even the children has juvenile diabetes, inborn diabetes, that is type 1 diabetes, it has not been taken into consideration. So these are the exclusions criteria. Children with current illness, hospitalizations, I have told that we have not taken. Then another thing is that some children, they have a difficulty in swallowing. Those we have not taken into consideration in this clinical trial. And clinically significant nutritional deficiency, severe malnutrition, as a children, we have not taken. Now, what was the primary outcome? We would like to check it. First one is that we go for anthropometric measurement. वो क्या है? हम लोग देखना चाहते हैं कि ये सप्लीमेंट देने से हाइट का क्या इंप्रूवमेंट हो रहा है, वेट का क्या इंप्रूवमेंट हो रहा है, बीएमआई. बीएमआई का मतलब क्या है? आपका वेट, आपका हाइट का मीटर पर स्क्वायर डिवाइड करके जो मिल रहा है, जो नंबर मिल रहा है, वो है बीएमआई. सो ये बीएमआई, यू हैव द 18 to 24, you have a normal BMI. If you have a less than 18, that means you are underweight. If you have more than 24, you are overweight. So this is your BMI. Now, second one is that mid upper arm circumference we have checked. And we have taken WHO Z score. Now, आपका एक चीज दिमाग में आएगा, ये Z score क्या है? देखो, हम लोगों ने 4 to 12 years ये चिल्ड्रन को ये क्लिनिकल ट्रायल के लिए सिलेक्ट किया. नाउ नॉर्मली एवरेज कितना हाइट होना चाहिए, वेट कितना होना चाहिए और इसका बीएमआई कितना होना चाहिए, वो एक स्टैंडर्ड है. और जो चिल्ड्रन है, आफ्टर टेकिंग दिस फॉर्मुलेशंस, their height, weight, BMI is similar to that average or not, or below, or it is more than that. That's checking basically known as WHO Z score. Now, coming to that, we would like to check the emotional and cognitive function. So that we have done through questionnaire. Okay, this questionnaire, it has been asked to the children, parents and guardian to understand their cognitive function, their social skill, their motivation, their self-regulation. These are the things we have checked. Even also, we have asked the question regarding academic performance. When this kid Nutri-Immuno, it has been given for 8 weeks, is there any improvement in case of your academic performance or not? Now, we have also checked the child eating behavior. That means enjoyment of food, eating speed. Even also, we have checked the appetite is good enough or not. Even we have done the cognitive assessment through MOCA. MOCA basically will give you the proper guideline regarding your cognitive function. Incidence of URTI means upper respiratory tract infection, and GI health during this study period. So we have checked that after taking this particular supplement, is there any upper respiratory tract infection or is there any GI side effects? And now there are other things also we have checked. That number of school day losses. That means earlier the kid was suffering from your allergic rhinitis, sneezing, running nose, nasal congestion. That means immunity was very poor, and every time there is a school day losses, that has been improved or not. Then we would like to check the safety and tolerability of the kid Nutri-Immuno. We'd like to check the temperature, pulse rate, respiratory rate, blood pressure. These are the things we have checked. Even also, percentage of children receiving antibiotic treatment. Antibiotic treatment, that is time frame, that is 8 weeks. Sorry, I'm outside because I'm doing this particular session from outside. That means I'm in a restaurant. From there itself, I'm taking, because where I am, if I go back home, then it is very difficult to take the session because I will be reaching home around 11 o'clock. So I'm taking this session in a restaurant where there is a little bit din and bustle. You will find that shout. There is a lot of noise you will find. Still, I'm trying my best to elaborate these things in this scenario. Please bear with me. I understand this because when I'm talking about there is a surrounding noise and all those things, it will disrupt a lot of things. Then we have also done the global assessment therapy. That means your CGAT. And also we have done the subject global assessment therapy SGAT. That is 0. If it is 0, no response. If the 10, then there is an excellent response. And that time frame we have taken for 8 weeks. Secondary outcome was there that we would like to monitor certain lab abnormalities. That after taking this particular kid Nutri-Immuno, is there any changes in the CVC? कंप्लीट ब्लड काउंट का कोई चेंजेस है कि नहीं, डब्ल्यूबीसी कम हो गया, आरबीसी ज्यादा हो गया, आरबीसी कम हो रहा है, रेनल फंक्शन टेस्ट आरएफटी, दैट मींस योर किडनी फंक्शन इज ओके, क्रिएटिनिन लेवल ज्यादा नहीं हो रहा है कि नहीं, and there is a glomerular filtration rate is absolutely okay or not. We have also done the LFT, liver function test. We would like to see that after taking this kid Nutri-Immuno, is there any increase of SGOT, SGPT, bilirubin, or GGTP? That we'd like to see that, because this particular SGOT, SGPT, if it increases, so we can understand there is an effect of this particular nutrition on the liver. It is damaging the liver. We have also checked the electrolyte is absolutely okay or not. Electrolyte imbalance hai ki nahi, that also we have checked during the study period. There are certain restriction was there. When they are taking this kid Nutri-Immuno, they have not taken any other health supplement during this study period. That means I'm giving kid Nutri-Immuno and the kid also taking Ensure. No, that has been stopped. Whatever supplement they are taking earlier, all supplement has been stopped during this study. But if concomitant medication was required during the study period, all concomitant drugs administered were documented in the relevant forms. Suppose the kid has already a respiratory tract infection, or the kid has a little bit seasonal allergic rhinitis, then there is a Montelukast levocetirizine, it has been given, or maybe your fexofenadine Montelukast, it has been given, that has been documented. Now here you see that there are two different sites we have taken. One is Sri Lakshmi Hospitals, another one is Grace in Trinity Hospital. Now here you will find that number of children screened 12, because total 24 patients, and number of children enrolled in both the sites 12, and number of children completed with 8 weeks of clinical trial, that is 24. That means there is no dropout in this particular clinical trial. Because of taking this particular kid Nutri-Immuno, there is a side effects, and that's why the kid is not in a position to take this kid Nutri-Immuno, and they have been dropped out from this clinical trial. It has not been happened. So everybody has completed the clinical trial. Now यहाँ पर हम लोग देखेंगे ये gender wise कैसे हम लोग इसको segregate किया. In case of male, female, we have taken 50%, 50%. So equally, we have distributed the male and female. And this 24 patients, you can see the 100. Now here, age group wise, we have segregated. 4 to 6 years, it was near about, take into consideration 11, 7 to 9 years, if you take into consideration, that is your 7, and 10 to 12 is 6. Now, I have already told about the Z code, and here we'd like to see that what are the parameters that we have already mentioned, that upper arm, circumference, academic performance, Z course, height assessment, weight assessment, BMI. Then also I have talked about the vital signs, temperature, pulse rate, respiratory rate, blood pressure that has been checked. Now, here we can see the first height improvement. Height improvement was excellent in the group of 7 to 9 age group after 8 weeks therapy, oral nutrition supplement. Here we can see that there is a really very good improvement. Here you see that improvement is statistically significant, particularly after 8 weeks. 8 weeks therapy, you can see that 10 to 12 years also it's a significant, and even 7 to 9 years. Now here BMI improvement in all groups after 8 weeks therapy, oral nutritional therapy supplement, that is your kit Nutri-Immuno, particularly if you see that it is really very good in 10 to 12 age group. It is not that good in 7 to 9 years. There is not much improvement, but whereas 4 to 6 years, there is a really very good improvement. Z-score wise also, if you see that there is a calculated using height, weight, date of birth and gender of the participant, their interpretation is normal, and the undernutrition or overnutrition in certain cases, only less than 2% undernutrition, overnutrition is there. Even optimum is 0 and normal is 2 plus minus. So Z-score, here we can see that if you compare with the average weight and weight, then you will find that this clinical trial participant who have taken 8 weeks therapy, their weight is matching with the average age. So they matching with the Z-score. Even also it has been found in case of your weight also, we have got the same data. Now, BMI also, if should be the average BMI in different age group, that it is matching with in case of and male. There is no discrepancies. See, mid upper arm circumference, there is not much difference. It is more or less movement is not very significant. We have not seen to that extent. Academic performance, yes, 7 to 9 age group, there is an improvement of your academic performance. And if we see the cognitive assessment, overall cognitive assessment across all age group, you will find that there is a significant improvement, cognitive functions. So here our primary outcomes, we have also checked that incidence of URTI or GI. So in certain, there is a little bit 1 day or 3 day or 2 days, you will find that there is a little bit GI infections. In GI infections means there is a little bit loose motion, nausea, vomiting. But it has been after taking this particular kid, no further loose motion or no vomiting, nothing. It has been even also epigastric pain or abdominal bloating, or 2 episode of loose stool. Yes, it has been found. And even epigastric pain in cases post 5 days, it has been that is have given the age wise 6, 7 to and 10 to 12. Temperature variations we have not found at all. Is with variation it has been found. Pulse rate was also absolutely, some difference were noted into 4 to 6 years age group, but other no variation of your pulse rate. Respiratory rate we have checked, and also no variations have found. Absolutely okay. These are the things basically saying that your efficacy of the product along with any side effect is this basically will give you understanding that my any side, that means I'm giving this kid nutrient खिला रहा हूं, लेकिन इसका रेस्पिरेटरी रेट क्या होगा, इसका पल्स रेट क्या होगा, इसका टेम्परेचर का कोई वेरिएशंस होगा कि नहीं, ये सारे क्वेश्चंस आपका दिमाग में आया, लेकिन आपका पास कोई डेटा नहीं है। जब तक आप क्लिनिकल ट्रायल नहीं करोगे, आपको कैसे पता चलेगा जे yes there will be a variations or there will be no variations, so you will not be able to understand. Blood pressure का कोई variations हुआ? No, the blood pressure was absolutely okay. Now, antibiotic treatment in 4 to 6, this particular age group, yes, 3 children, they have taken antibiotic. That is your cefixime and azithromycin. 7 to 9, only one. 10 to 12, nobody has taken any antibiotic treatment. Now, here you can see, according to the investigator, 20.83% of participants exhibited a good response, while 37.55% demonstrated slightly above average. Excellent response in 20.83%. Here also you will find your very good result in case of 20 to 83, even good response in 30 to 83, and your health report 4.1% participant experienced also are good enough. So in a nutshell, what we have got it? We have got it lot of things. क्या क्या मिला? एक तो मेरा cognitive functions really good improvement, educational performance improve हुआ, height improve हुआ, growth है, even also infections नहीं हुआ, कभी भी कुछ लूज मोशन हुआ 2-3 दिन में वो ठीक हो गया। एंड ये क्यों, ये नॉर्मल चाइल्ड नहीं है, ये सारे मैल न्यूट्रिएंट चाइल्ड को हम लोगों ने लिया। ऑलरेडी दे आर सफरिंग फ्रॉम गैस्ट्रोइंटेस्टाइनल इन्फेक्शन, अपर रेस्पिरेटरी इन्फेक्शंस बिकॉज ऑफ द low immunity, because their food intake is very less, their immune system is not strong enough. So initially when आप जब कोई प्रोटीन सप्लीमेंट और vitamins minerals दोगे, थोड़ा body will take time to adjust because they have not got it, because they are suffering from malnutrition. But it has been found that yes, after 2 to 3 days, automatically it has become normal. ओवरऑल किड न्यूट्रिशन सप्लीमेंट का एक वर्ड में हम एक्सप्लेन करेंगे जे यस इट प्रोवाइड्स अ हेल्दी ग्रोथ एंड गुड इम्यून फंक्शन, नॉट ओनली दैट इसका कॉग्निटिव फंक्शन एंड एजुकेशनल परफॉर्मेंस विल बी गुड इनफ, एंड yes of course we require the larger of sample size, but the pilot study में जो whatever we have got now, we can confident enough that my kid Nutri-Immuno is really a balanced nutrients for my children, and this will give overall growth, height, given also cognitive function, educational performance will be good enough, and not only that, immunity will be also good enough. Thank you. This is the overall findings we have got from this clinical trial. Even after this clinical trial and everything, we have got an excellent result. This is the first fixed dose combinations clinical trial in India. Nobody has thought about that. You know that one particular jar, it was 4,500. Okay. Now, each jar we are giving at the rate of 1,500, provided if you buy 3 jars together in one invoice. That means 4,500, you are getting 1 jar. Now 4,500, you are getting 3 jars. Have you thought in your lifetime? You have not thought in your lifetime. आप बोलोगे ये ऑफर क्यों दिया? Because when this clinical trial has come, I have told the board of directors of Health Matters that you do one thing, at least you give almost free of cost this particular kid Nutri-Immuno. All mothers, they should give this kid Nutri-Immuno to their children, and they can observe the improvement. Lot of people, they have not used this because of the price, 4,500. What will be the result? Lot of question has come. Now 4,500 we are giving free. That means what is the cost price? That cost price they are giving this particular product. I want that each and every mother should give this kid Nutri-Immuno to their children and observe the result and tell us. And I know that there is no profit, nothing, because at what rate we have manufactured the products, we are giving at the same rate. Let's see. That will give you a confidence or not. I want the confidence from all of you so that you can say that, yes, my product is backed by the clinical trial, clinical data, and there is the evidences. And yes, it will give proper result if the kid Nutri-Immuno, if it is given to children, improve the growth, function, then digestive health, gut health. Yes, of course. So this is all about. Thank you very much.
थैंक यू सो मच डॉक्टर विजय देव सर. इट इज अ ग्रेट प्रिविलेज आज आप इतने बिजी शेड्यूल के साथ भी इस तरह आज का प्रोग्राम को आपने कंडक्ट किया, और इट वाज अ ग्रेट मोमेंट, हिस्टोरिकल मोमेंट ऑल ऑफ फॉर अस, क्योंकि इतिहास हम लोग इतिहास का गवाह होने वाले हैं, क्योंकि हर माँ बाप के लिए अपने बच्चे बहुत ही इंपॉर्टेंट होते हैं, उनका हेल्थ, उनका इम्यूनिटी, और सबसे बड़ी बात है उसका कॉग्निटिव, मतलब उसका अगर समझने, क्योंकि एक मेजोरिटी होता है बच्चे लोगों में, माँ बाप परेशान होते हैं ये इतना जिद्दी क्यों हो जा रहा है, इतना कंसंट्रेशन पुअर क्यों हो जा रहा है. ये माँ बाप का गलती नहीं है, इसके पीछे सबसे बड़ा रीजन जो होता है उसका लो कॉग्निटिव, इम्पेयर्ड कॉग्निटिव एबिलिटी. और इस कॉग्निटिव एबिलिटी के कारण बहुत सारी चीजें माँ बाप फेस कर रहे हैं, बच्चे ना चाहते हुए भी इस तरह एक्टिव हो जाते हैं. सो इसमें मोस्ट क्रूशियल फैक्टर देखिए, ये जो कॉम्बिनेशंस है कोलोस्ट्रम के साथ, ये जो डीएच कॉलिन और एल मेथियोनाइन का, ये पहली बार इंडिया में इस तरह कॉम्बिनेशन का, और ग्रेड 1 कोलोस्ट्रम के साथ ये नतीजा आया. कॉग्निटिव एबिलिटी में आप देखिए हर एज के बच्चे में कॉग्निटिव एबिलिटी में इंप्रूवमेंट आया, क्योंकि इंडियन चिल्ड्रंस जो है इसमें नॉट ओनली इन द इंडियन सीनरी, इन द होल वर्ल्ड बच्चे में मतलब ये जो कॉग्निशन बोलते हैं, जैसे जिसमें एक एडीएचडी का भी इशू आ जाता है, उनके अटेंशन डिसऑर्डर होता है, वो पुअर कॉन्सेंट्रेट होता है याद रखने का, या उनको कुछ में फोकस करने में प्रॉब्लम होता है. तो आप सोचिए अगर बच्चे में ये मेमोरी इंप्रूव होता गया, उनको लर्निंग कैपेसिटी बढ़ता गया, तो हर माँ बाप के लिए तो एक आशीर्वाद हो सकता है. और साथ में ये ऑलरेडी क्लिनिकली टेस्टेड है, प्रूवन है, क्योंकि दोस्तों ऑनेस्टली बताऊं, मैं 20-25 साल से इंडस्ट्री में हूँ. अभी भी कई लोग इसको मैजिक क्लेम करता है, कोई भी कुछ भी बोल देते हैं, देखो अच्छा ऐसा नहीं है, रिजल्ट नहीं है, बट रिजल्ट क्या मिला के आ रहा है वो भी देखना चाहिए. मैं बार बार रिपीट करना चाहता हूँ, रिजल्ट अगर कोई केमिकल मिला के आता है, रिजल्ट अगर कोई मेडिसिन के साथ आता है, रिजल्ट अगर कोई स्टेरॉइड मिला के आ जाता है, रिजल्ट अगर कोई सस्ता रॉ मटेरियल या सस्ते इंग्रेडिएंट से आता है, ऐसे रिजल्ट में फायदे से ज्यादा लॉन्ग टर्म में नुकसान हो जाएगा. तो दोस्तों इंडिया का सबसे बड़ा जो ये हेल्थ ड्रिंक्स बनाने वाला कंपनी है, दैट इज तिरुपति ग्रुप, वहां से हमारे प्रोडक्ट बन के आ रहा है. और ये पहली बार, ऐसा नहीं है वहां से दुनिया का टॉप से टॉप बाहर का कंपनी भी वहां पे बनाता है, आईसीपीओ जैसे कंपनी, पीडीएसयू जैसे कंपनी भी बनाते हैं. तो बट वी आर द ओनली कंपनी इन इंडिया जो हम लोग इस तरह क्लिनिकल रिसर्च को स्पॉन्सर किया, इतना बड़ा बजट का हम लोगों ने रिस्क लिया. और आज क्योंकि हम लोग कॉन्फिडेंट थे, डॉक्टर विजय थे सर शुरू से कॉन्फिडेंट थे, ये जो फॉर्मूला हम लोगों ने बना रहा है ये द बेस्ट फॉर्मूला है. तो मैं सभी को गुजारिश करूंगा, ऑलरेडी लगभग एक्टिव मेंबर है मोर देन 2500 से ज्यादा, 2500 से ज्यादा एक्टिव मेंबर है, हजारों से ज्यादा हर महीने का पे आउट जाता है. मैं सभी हेल्थ मैटर्स फैमिली मेंबर को रिक्वेस्ट करना चाहता हूँ, हाथ जोड़ के रिक्वेस्ट करना चाहता हूँ, एटलीस्ट अपने बच्चे के लिए, आपके किड्स के लिए, आपके चाइल्ड के लिए, आपका जो ग्रैंड सन है, ग्रैंड डॉटर है, तो इनके लिए डोंट कॉम्प्रोमाइज, क्योंकि ये इतना जबरदस्त ऑफर है. 4500 रुपीज में आपको 3 डिब्बा मिल रहा है, दैट इज ओनली 1500 ईच जार. और इतना बढ़िया क्वालिटी, एक जार कम से कम मेरे हिसाब से 20 से 25 दिन चली जाते हैं, अगर 3 स्कूप भी दे देते हैं तो एजेड है, अगर 12-14 साल में भी है उनको भी दे सकते हैं। सो इसका फायदा दिखे दिखे बच्चे में दिखने को आपको आएगा, तो आपको भी काम करने में, आपको भी एक बड़ा पर्पस लेके हेल्थ मैटर को आगे चलाने में, आगे बढ़ने में मोटिवेशन मिलेगा। और मैं कोशिश उम्मीद करता हूँ आप सब किस न्यूट्रीमिन्यू को भरपूर लोगों तक इसका जो एक एक्सक्लूसिव जो रिसर्च स्टडी सामने आया है, इसको आप लोग जरूर बताएंगे। आपका जो होम फिजिशियंस है, जो आपका घर के बच्चे को ट्रीटमेंट करते हैं, उनको भी जरूर बताइएगा, ताकि उनको भी मालूम होना चाहिए कि इंडिया में ऐसा एक कंपनी ने इस तरह रिसर्च करके ऐसा प्रोडक्ट लाए हैं, और बहुत ही आज के दिन में अफोर्डेबल रेट में आ गया। तो कोशिश करिए ज्यादा से ज्यादा लोगों का इसका बारे में बताने में, और इसका ज्यादा से ज्यादा बेनिफिट लाने में। थैंक यू सो मच। फिर से मिलेंगे, और इस जो नया इतिहास हम लोगों ने रचने जब जा रहे हैं, इसको आप भी शामिल हो जाइए। विश यू ऑल द बेस्ट। थैंक यू वेरी मच। नमस्कार।